Hello, my name is George Silberschatz, and I'm very pleased to introduce and guide you through this DVD on psychotherapy case formulation based on control mastery theory. This DVD that you're about to watch contains an intake interview which will serve as the basis for our formulation, and various segments from throughout the therapy which we will use to show how the formulation is used to understand the clinical process. Before turning to the intake interview, I want to give a very brief overview of control mastery theory. According to this theory, traumatic childhood experiences lead to the development of pathogenic schemas. These schemas include unconscious pathogenic beliefs, identifications, and unconscious compliances. Pathogenic beliefs are the affective, cognitive representations of these early traumatic experiences. Identifications and compliances represent the child's need to maintain close emotional ties to parents. For example, a child who was mistreated by her parents developed the unconscious pathogenic belief that she deserved mistreatment. She complied with this belief by developing relationships in which she was frequently mistreated, and she identified with her parents' mistreatment of her by subsequently mistreating other children. When patients come to psychotherapy, they are highly motivated to disconfirm these pathogenic schemas, and there are three primary ways that they may do so. First, they can use the therapeutic relationship per se to disconfirm certain pathogenic beliefs. Second, they can use the insight provided by the therapist to help them disconfirm pathogenic beliefs. And third, they can test their pathogenic beliefs directly in the therapeutic relationship. Control mastery theory identifies two primary testing sequences. The first is called transference testing. In a transference test, the patient tries to determine whether the therapist will traumatize her as she had been traumatized by her parents. For example, the patient who was mistreated in childhood would test the therapist to see whether the therapist will mistreat her. The second kind of test is a passive into active test. And in this test, the patient will traumatize the therapist as she had been traumatized as part of an effort to master the trauma. So the patient who was mistreated will mistreat the therapist to see how the therapist handles mistreatment. The DVD you're about to watch contains three parts. The first part is an intake interview of a patient in her 40s who presented in a state of crisis. The case formulation is part 2. Part 3 represents test sequences taken from later sections of the therapy. After each test sequence, I will describe how we use the formulation to understand the clinical material. As you watch the intake interview, you might want to take down some notes about how you understand what the patient's main problems are and how the therapist is most likely to be helpful to the patient.